I'm Gilhespy. I'm a practice manager support assistant at Benfield Park Medical Group, which is a GP surgery in Newcastle, and I'm a digital champion for North East and North Cumbria. So we already had a digital focus within our surgery, and I think within primary care one of the most important things is making every patient contact count. We have limited time in the day, it's busy, it can be stressful. So having digital systems integrated into our day-to-day work means that things can just run a bit more smoothly, it runs a bit more effectively, and especially from a personal point of view at our practice, going green, reducing our carbon footprint was something that was really important to us, and by being digital or being more digital, that was really going to help towards that. So when we signed up to Digital Champions, we created an action plan, and a few of the things that we wanted to focus on was health promotion, because we felt that that reduces clinician time, because we find that people phone up and they want an appointment for example, a UTI or a sick note or something that actually doesn't need an appointment at all. So that was something that was really important, was that using digital to just increase our patients' knowledge of what they can actually access online and what they don't need an appointment for. But also, one of the things that we included in our action plan that we wanted to use more was the appointment system invitations. So this is an inbuilt system into System 1, or we use Accurix for it. And this allows us to bulk send out messages to our patients, and then they can just click a link and book an appointment when they want. For both flu and COVID, we sent everyone that has a mobile number, we sent them appointment invitations. It worked amazingly well. I remember sitting, looking at my System 1 and just watching them book in, and that maybe took me half an hour to an hour to batch send out those, to type it out and to wait for the system to load. But if I'd have phoned those patients, that would have taken me days. But probably the one that I've seen the most success in is our smears. Last year we were above average on both targets. We're on track to do the same again this year, if not succeed that. And that is simply because once a week we batch send out text messages that have appointment invitations, and we've also made it a focus on our social media sites and website. Once they've booked in, they get another link which has a video on, which just explains a little bit more. It has some links to the NHS website. So we've already seen a massive improvement in our uptake on cervical screening. Digital reduces those pressures. I think that's really the main thing about this, is that digital, it may be a small investment in time to start off, to learn a new system, to train people up, but actually it's really not that much work. And in the long run, how much time you're going to save is definitely worth it, especially I think probably our main winter pressures are flu campaigns, if your surgery is running COVID campaigns. Well, all of that work can be completely reduced just by using digital. So although there is a lot going on in the winter within primary care, I think digital reduces those pressures. Yeah, it definitely makes it worthwhile.